That's 33 more than yesterday. And I'm very sad to report that yesterday set an unfortunate record. Five new deaths yesterday. Five people passed away yesterday. That's the single biggest day since this crisis began. To the families and friends of those loved ones, we mourn with you. I have never found a way at a visitation or when someone's passed, there's no magic words you can say. All we can say to the folks that are losing folks each and every day, whether it's to the virus or any event, we're sorry and we're here for you. So let's all get through this together. We're going to continue to light Metro Hall in green, the Big Four Bridge in green. That's the color of compassion. And I encourage houses, if you have some green and lighting, to put that out there just to remind us that we're all in there in this together, and put that up in memory of those that we've lost during this crisis. As I mentioned, so many people are doing well in the community and they're making changes. I know this is hard on everybody. None of us signed up for this, but it's here with us, so we've got to deal with it. I do want to speak for a minute to people who still don't seem to have gotten it, who haven't really fully integrated the scope of this global pandemic we have right now and the global crisis that we've had. Folks that have not changed their daily behavior. If you have not changed your daily behavior in this world of COVID-19, you are not helping the city, you're not helping yourself, you are not being the kind of citizen really that we all need for you to be. So these deaths that we have to make it real to you. 14 people dead in our city from COVID-19, five just yesterday. Yesterday in America, over 1,000 people dead from the COVID-19 virus. Almost 7,000 now in America, and it's going like this. So we can expect more than 1,000 again today, unfortunately, and over 54,000 worldwide. So we have to ask ourselves, how high do these numbers have to go before everyone says, I've got to do something about this? And so if you're not, I just ask you, please reflect internally. We need your power, and you have the power to change your behavior, impact the lives of those around you in a very positive way. So, for those that are continuing to do this and have been great from day one, I say thank you. I'm proud to be on the team with you. For those folks that are still denying this, we need you. Come on board. We're not going to judge you for any past behavior. We need you on board today. And we're going to have a big test of that this weekend with this good weather. I also want to ask our grocery stores, our home improvement stores, our drug stores, those type of retail stores that are still open for essential business. Some of y'all are doing great. Target's got the little red dots there to say, keep 6 feet away from each other. Walgreens has got up some tremendous signage and black marks on how to stay 6 feet apart. So we see practices like this throughout the city, but we are still seeing too many people inside some of our bigger stores that then are getting closer to each other. So I asked the general managers out there to make sure that you've got the proper signage, the proper distancing. If that means limiting the number of people that you can put in the store, and you need to have 6 foot distancing outside, we need you to take those measures. We need you to take them now. Shoppers, same thing. We need you to make sure that you're going to have 6 foot distancing in your store. If somebody's getting in your space, just give them a nice smile and ask them to give you space. Some people just need a little reminder because remember, this is still kind of a new reality we have here. So, everybody, as we go on, as you go out this weekend, please remember 6 foot spacing. You can control this. You might feel like you are just reacting to the world right now. No, you can be proactive and do things to safeguard yourself, your family, and your community. I've been on some calls today with the United States Conference of Mayors and the Metro Council to talk about what's happening in the city and the country. And we're trying to pick up lessons that we can learn from anybody that we get in touch with. The one thing that we do know from studying this pandemic in other places is that there are a lot more people with COVID-19 in our city than 274. So you might say that's not a very big number. Now it's growing rapidly every day, but there's a lot more people. I mean, you can put a zero behind that 274, maybe another zero. We just don't know. Everybody has to act like they have the virus. Okay, so when you're asymptomatic, that is, you have no symptoms, you're still passing this virus from person to person. And one factor that we know is that as testing operations scale up, tracking all the testing and capturing all the results in real time is becoming more and more challenging. You're seeing that at the state and federal governments. They're facing the same challenge, and we're working with hospitals and private labs to gather all of that data in one place. But because the virus is spreading so quickly, you can see that in other cities in particular, New York, Detroit, we're always going to be catching up to it when it comes to reporting the numbers, and that's just the reality of the situation that we're in. That's how a virus works. But we're going to continue to update you all every day and give you the most accurate picture we have of what's happening in our city. Now, one of the critical measures and one of the best measures to see how we're being impacted locally is to know what's happening in our hospitals. We're in constant communication with Norton, Baptist Health, U of L. I want to thank them. I want to thank our healthcare workers. I want to thank our janitors. I want to thank our staff at our hospitals. They are on the front lines. Okay, they are the soldiers in this war that are being impacted by all the folks that are coming in with illness, lots of new illness in the community with COVID-19 and just regular illness. So I want to thank you to our healthcare workers out there and everybody supporting them. They are taking care of our sickest while we're trying to keep them healthy as well. That's probably our biggest constraint. You know, we talk about surge capacity with beds and we talk about more PPE. We have got to keep our healthcare workers in good shape. Now, as it relates to measurement, at this point, our hospitals still have capacity. They are not overwhelmed with COVID-19 patients, so that is very good news to us. Our ICUs and our isolation wards have capacity, but as we've seen across the country and the world, that can change very, very quickly, 24 hours, 72 hours. And it's up to us, obviously, to prevent all of that. That's what all of this staying at home is about, is to make sure we don't have a big spike so that we can keep our healthcare system up and running. And we know how to do that, right, everybody? Repeat with me. Now, stay home, stay home, stay home. Okay. Wash your hands, 20 seconds. Sing happy birthday to Gene Porter twice. That's about 20 seconds. And when you have to leave home, keep 6 feet of life saving space between you and other people. And most of us are doing that. And that's why so far we've avoided the scale of the tragedy that we've seen in other cities. So let's keep it up. Let's take it even more to the next level here as this virus gets more and more present in our community with more and more people infected. So one of the ways to do that is plan your week so you can reduce the trips outside of your house for food and supplies. Dr. Sarah Moyer, she's our Chief Health Strategist, Director of Public Health and Wellness. She'll be available for questions later to the media. She said it in a beautiful way yesterday. She said, the coronavirus doesn't move. We move. People move. And the virus needs us, people, to provide it with new hosts. The virus is looking for new hosts all the time to jump from you to the next person and move on to infect somebody after that. But when you stay home and limit your contacts, the virus has no place to go. Okay, so that's your offensive strategy to beat the virus. Stay home. Don't present those opportunities. And then what happens? The virus dies, goes away. So let's work together and commit ourselves to deny the virus. Okay, hashtag deny the virus so it doesn't spread to friends and families and fellow Louisvillians. That is how you beat COVID-19. All right. Let's talk about public spaces. As I mentioned, the weather is getting better. Springtime, everybody likes to get out. So, with the beautiful weather we've got for this weekend, I want to remind you that while we've left our parks, golf courses, and other recreational public spaces open so you can get outside, get some fresh air, and exercise, social distancing has to be applied. So, like the last picture you saw, this picture you saw, these folks might think they're social distancing. They're a little bit further apart than normally are. This is not good social distancing, okay? They're within 6 feet of each other. All these folks have got to do is stay 6 feet, wrap down around the corner. They will still get their Dairy Dell. Dairy Dell rocks. Everybody loves Dairy Dell. Just get 6 feet apart while you're going there, okay? This is non-negotiable. So 6 feet of distance between you and anyone who doesn't live in your house. There are no exceptions. All right, so please comply. Save your life. Save the lives of others around you. Now, we expect in Cherokee, Iroquois, Shawnee, uh, any of our parks, Seneca, Crescent Hill, any public golf courses, Big Four Bridge, you have to stay 6 feet apart. And this is our test this weekend to see whether or not our enhanced communications have worked. So we have not restricted access to those spaces because we've ramped up our communication even more. More people know what this virus is. Everybody should by this point. And I'm trusting the people of our city to make the right choice, which is a smart choice and it's a compassionate choice for you to stay 6 feet away. And by far, most people are doing that, as I've said repeatedly. And I want to thank everybody who's making the effort to practice social distancing because you all are saving lives by doing that. We still get reports of people from all parts of town and all demographics gathering in groups and acting like we are not in the middle of a global crisis. Folks, you cannot do that when we're in a global crisis. Imagine if this virus that we can't see was an actual person or an army. They would be all over the city with troops and tanks and big guns. Last thing we'd all be doing is hanging out outside. You'd be taking cover. All right? That's what we need to be doing right now. So if people continue to congregate in a way that is not appropriate from a social distance standpoint, unfortunately, I will have to close these public spaces to everyone. I will not hesitate to do that. My number one job is to protect the safety of everyone in our community. And if we cannot get the cooperation of our community to do that, then I'm being forced to take the next step, which I do not want to do, but it is the obvious thing to do to safeguard the most amount of people. We will continue to make the right choice to save the most amount of lives possible. So, I kind of feel like the dad that's always saying, "Oh, if you go out, we're going to do this to you." Nobody ever likes to do that. I don't like to do it either, but I love the people of our community. Okay. And so I would rather take stern measures right now than go to another funeral. That's the bottom line. Okay. So everybody, please help out. Spread the word. Parents, know where your kids are. No exceptions. Okay. Parents have got a job. Guardians got a job to do here right now. And young people, talk to yourself. The new cool, stay at home. Connect over the digital world. It is uncool to be outside. All right. TARC. I want to thank our bus drivers. Bus drivers has a tough, tough job. They are transportation specialists. Sometimes they are therapists. They are tour guides. They got a tough job. It's a very vital job. Our maintenance team at TARC, I want to thank them for keeping our buses rolling. Our staff for making sure our public transportation is working the way it is. TARC's doing a good job right now under a very difficult situation. But one of the many challenges in managing the impact of COVID-19 is public transportation, and specifically the routes that TARC is on, keeping everybody rolling. Because the truth is that thousands of people depend on our city for TARC to take them to get food, to medicine, if they're essential businesses, taking them to the businesses. So TARC has got to roll in a way that's effective. Now, at the same time, the more crowded the buses are, the less we're able to practice social distancing. So our leadership at TARC has been working hard to accommodate the needs of riders with the urgency of preventing the spread of COVID-19. So all fixed route buses and TARC 3 vehicles are cleaned and sanitized daily in accordance with CDC guidelines. That's just one example. And today is TARC is announcing some updated policies. We have a fantastic citizen in Laura Douglas and Margaret Handmaker, Matt Golden, folks that have stepped in at TARC to help out during this transition period that the community is aware of. And Laura Douglas is with us today. She's our interim co-executive director at TARC, well-known, great community citizen. So I want to welcome Laura and ask her to share a few words with us on policy changes at TARC. Take it away, Laura.
Good afternoon, Mr. Mayor, and good afternoon, everyone. I'm happy to report that TARC is standing tall during the current crisis. All of our drivers have been equipped with PPEs. They have gloves, they have hand sanitizers, they have wipes to keep their area of the bus clean. And because of a partnership we have with some of our friends in the arts community, some arts folks have even made masks for our drivers to wear. And any driver who needs a mask or who wants a mask can pick up one from his supervisor. You may have noticed on the coaches that what we call the standee line has been moved. That's that yellow line you see behind the bus driver. It's been moved back now 8 feet to create a larger space between the driver and the folks on the bus. In addition to that, our bus ridership has been limited to 25 folks per bus. On a typical run, when everything was normal in Louisville, a bus would hold 60 to 70 passengers. We've now restricted that to 25 people per bus in order to have some social distancing. And more important, for those who ride the bus, we want you to know that all buses are cleaned and sanitized daily. Cleaned and sanitized daily by our very hard-working maintenance crew. Now, as of today, TARC is asking all of our riders to use TARC for essential services only. Perhaps you have a doctor's appointment or you're trying to get to work. Use TARC for essential services only. That way, we can further enforce social distancing. As the mayor said earlier, we know we're going to have a fabulous weekend weather-wise. We want to appeal to the general public to keep in mind as you're out and about, even on this glorious weekend that's upcoming, to use TARC to get to essential services only. This is a policy that we're going to keep in place at least until the 30th of April. Again, I want to congratulate our drivers and our maintenance crews for the mighty job that they have done during this community emergency. I think the general public is aware that when the governor and the mayor declared a state of emergency, TARC was recognized as an essential community service. That means that we have to be up and running throughout the duration of the crisis. We have to get the doctors and the nurses downtown to the hospitals to work and all over the community to the community hospitals. We have to keep folks who are providing essential service with the ability to get back and forth from where they live downtown. So we are going to keep running, and all of our employees are dedicated to that mission. But let me say it again. I want to remind you, as of today, please use TARC for essential services only. And thank you, Mayor, for the support that you've provided to us and everyone here at TARC.
Thank you, Laura. You guys are amazing the way you've stood up to this thing and risen to the challenge. And again, I want to thank everybody associated with TARC, from our drivers to our maintenance team. It's hard to keep an operation like yours rolling all the time. So thanks again. Great job.
Thank you, sir.
Now, one of the interesting things about this crisis is how much everybody has learned about the city and city government. I frequently have said before this that, government is kind of like oxygen, air. People are just going to assume it's always going to be around. And when you breathe, you're going to have oxygen, and government services are going to be there. So people now are understanding kind of the complexity of running a city. So we appreciate all the good thoughts and calls coming in, thanking our entire Metro government team and TARC and the water company and MSD. MSD is with us today. During this crisis, we've got to be mindful of how the changes our city has made in response to COVID-19. They affect all of our critical infrastructure, and that includes our sewers. Our sewer system is like amazing. You probably never thought about it before, but our sewer systems are really old. Some of it go back to the Civil War and is still operating today. where they're out of sight. So we just kind of take that for granted with as well. But now with more and more people at home, different parts of our sewer system and water system are having different strains put on them. So our partners at MSD are working to keep sewers going, drainage they're in charge of for the city, and then also flood protection systems functioning while also practicing social distancing and workplace hygiene for their employees. So, right now the weather's been pretty good. So we're dealing with this pandemic. But imagine if the rains start coming, the city starts flooding. We've got to deal with that as well. So MSD is on the front lines of that as well. Our MSD, like our water company, amazing, known as some of the best in the country at what they do. So I want to thank those warriors out there for keeping our city running the way that they do. And I'm joined now by Tony Parrott. He's the head of MSD. And Tony, from your perspective, because just kind of we asked you to come on to share some of your thoughts on how people could help us get through this crisis. Tony Parrott.
Thank you, Mr. Mayor. And, as you mentioned, MSD is a vital asset for the community. As we navigate COVID-19, we have to proactively continue to manage the wastewater, flood protection, and stormwater systems that protects the community, albeit we're having to do it in a different way. We continue to operate 24 hours a day, 7 days a week. We have closed our buildings to public access, and the majority of our employees that can work from home remotely are doing so. However, we have so many frontline operators and utility workers and those folks that are working out in the field every day, operating our wastewater treatment facilities, taking care of our drainage, and making sure that our flood protection systems are in working order. We're doing it while practicing social distancing and physical distancing in most cases to make sure that we're protecting our workers and to make sure that we're keeping our facilities and our workplace as clean as possible. Our MSD team, our work is very vital, not only to the community, but also to the environment. We are doing a lot to make sure that we're helping minimize the financial hardship for customers. We have temporarily, along with the water company, waived any type of new late fees for residential customers and are looking at making sure that there's no turnoffs of services due to non-payment during this pandemic. We have an existing program to help our senior citizens who qualify for a discount on their sewer charges. And we're also looking at how we can increase our donation to an existing Drops of Kindness program sponsored by the Louisville Water Foundation that is designed to help customers who have demonstrated hardships to pay their water and sewer bills. We have everyone during this pandemic is obviously at home during an extended period of time. And we want to remind everyone out there that we have to avoid making a bathroom no-no, which is we can't be flushing anything down the toilet but toilet paper. So if you're flushing flushable wipes, if you're flushing baby wipes or paper towels, all those type of things are really things that you should be throwing into your trash can. We do not want you exacerbating any type of plumbing or significant problems within your own plumbing or problems within the MSD system. Since this pandemic began, we're already seeing an uptick in being able to respond to significant increase in folks that are having clogged sewer lines. So help us help you, and do not put anything down the toilet but your toilet paper. Everything else should go in the garbage can. We are working every day to make sure that we're protecting our employees, our MSD crews. A lot of shout out goes to all of our staff that are on the front line, the women and the men that show up every day. A lot of shout out to the folks that are keeping our facilities properly disinfected so that our workers are able to do what they need to do. And together, we'll be working with every entity and with the community to make sure that we can flatten the curve and emerge as a stronger community when this is over. So we appreciate the opportunity to come and speak today. And thank you, Mr. Mayor, for your leadership and everything that you're doing.
No, it's great to be on the team with you guys, Tony. You and the board and the whole team at MSD just do a great job with national recognition, global recognition for some of the engineering projects that you guys have completed. So really want to say thank you for all the great work you guys are doing.
Thank you.
All right, let's switch over now to another essential part of our community and for us as human beings, and that is the blood that keeps us alive. So another consequence of this COVID-19 crisis is that it has led to the cancellation of thousands of Red Cross blood drives across the country, including many of them here in our great city of Louisville, Kentucky, as well. So what that means is our hospitals, our healthcare workers, and patients are facing a critical shortage of blood right now. So the Red Cross is holding a blood drive this coming Wednesday and Thursday at the KFC Yum Center. It is a big open space so they can accept blood donations while still following best practices for hygiene and social distancing. So we have seen some amazing displays of compassion during this crisis. So the One Louisville COVID-19 Response Fund, for example, JCPS distributing meals to kids out of school, millions of acts of kindness by people to their neighbors. So now I'd really encourage people to give blood. Now you might be saying, well, wait a minute, I thought you told us to stay home. Okay, well, look, this is an essential service for people to have blood and to keep our hospitals running. So if we do this the right way, we can do it smartly. As I mentioned, Red Cross has got their system set up so there's going to be 6-foot social distancing as well. So when we roll up our sleeves and respond to this call, we can do this in an appropriate way. So healthy donors of all blood types are needed. And to help maintain social distancing, you must make an appointment. Okay, so people just can't walk in. That's part of the strategy to keep social distancing in place. So to schedule your appointment, so again, the only way you can participate, go to redcrossblood.org, redcrossblood.org, and enter the sponsor keyword, which is KFC YUM, KFC Yum. Okay? So again, blood is in seriously short supply right now for hospitals and patients, and the Red Cross is holding a blood drive Wednesday and Thursday this coming week, April 8th to 9th, from 11 to 5 at the KFC Yum Center, and there is free parking for donors, courtesy of our friends at the Parking Authority, another great part of our city. I've had a lot of people ask me, what can I do? How can I help? How can I help our hospital system? So here's one way you can help. Donate blood if you're capable, okay? Please help us out. Now, another group that has become part of our rock stars during this crisis and much more well known is our Department for Resilience and Community Services. So what this pandemic has presented us with is a healthcare crisis, a financial crisis, and a social service crisis as well. So RCS, our Office for Resilience and Community Services, is on the front line of social services. So I want to thank them. When you work at RCS, you got a heart as big as the city because you work there because you want to help people. And that's what gives you maximum satisfaction. I'm proud of our team for what they've done each and every day and during this crisis as well. They've already handed out tens of thousands of frozen meals to seniors over the last couple of weeks. They've done an incredible job with our March for Meals program. Now, as we move forward, we will continue to serve the 7,000 meals a week to some of our most vulnerable seniors. But there's going to be some changes in the process. So those details are being finalized as we speak, and they'll be issued before the night is over. So keep an eye out for information from the Office for Resilience and Community Services That'll be coming soon. And again, we will continue to serve the 7,000 meals a week to some of our most vulnerable seniors. So thank you to RCS. We've talked about on this media briefing lots of physical health stuff, but we're also focusing on mental health. This morning, my team hosted a terrific town hall discussion with some mental health professionals to provide advice for people who experience trauma or anxiety. Rashad Abdul Rahman, who's our director for Office and Safe and Healthy Neighborhoods, took part in that discussion, and I was struck by the one continuing theme in all of their comments, and that was the need to approach this pandemic situation with grace and with hope. Think about that. If you're kind of feeling sorry for yourself right now, think, how can I be full of grace? How can I be full of hope? How can I be a messenger of grace? How can I be a messenger of hope? Everybody can do that. Okay, that's a way you can be proactive. So grace and hope. And with that, got to deliver that kind of love and deliver that kind of compassion, because it is like really normal right now to feel anxiety, feel a little depression, feel unsure. If you're feeling that, you're normal, okay? If those thoughts haven't crossed your mind at all about what's going on and how this might change my life, that's probably not normal, okay? So just understand that those are normal feelings for everybody. And we should be as understanding and forgiving of ourselves and those around us as possible. It's easy to get a little impatient, a little short tempered. That's when you say, I've got to check in to the Lift Up Lou mindfulness session tonight because I need some deep breathing exercises to get through this thing. So everybody remember, you can take some deep breaths. It helps out a lot. Okay, we're all in this together. So grace and hope. And it's important to maintain communication. Okay. Some people feel like they need to shut down when they get anxious and depressed. Other people open up. So make sure your world is still big right now. You might be inside of your house, but have a big world out there in terms of whom you're communicating with. I've gotten some calls and communications from folks I haven't heard from for years that are just kind of checking in, making sure everybody's good. We're all busy, or at least I'm busy, but I still appreciate that. Okay, so think about other people you haven't thought about in a little while, and give them a buzz and tell them you love them, and to give them a virtual hug like the Urban League is doing every day to their teammates, and open up a little bit. It's funny when the whole world's under this right now, so everybody's feeling a little exposed. Talk about your exposure. Say, look, I'm not feeling very good about this and that, and I've never really talked about it with anybody else before, but I need somebody to listen to me right now. That will be received very well by others. And one of the things when we get on the other side of this is we're all going to know each other a lot more. I can tell you, it's been hard for me that when my wife, she's good now, but she came out of isolation on day 13. So for those of us that have been impacted by somebody going through this or have lost somebody, it's hard. I mean, you obviously start thinking about things you don't want to think about in terms of what their health is, or are they going to recover for something like that? So it's stressful. And again, that's just normal. Your kids may not live in the same city. Our two daughters don't live in Louisville. We got a new grandchild that's 4 months old, and I just wonder, when are we gonna be able to hug her next? So it's normal to have thoughts like this as you go through something like we're going through right now. So kind of embrace those feelings, know you're alive, know you're human, and we're going to get through this together. So don't isolate yourselves emotionally, and know that this is temporary and that we're going to get through it, and there's services available to help you if you need them. 7 counties has several 24/7 crisis lines. You can go to their website, 7counties.org, for more information. You see that on the screen right now. And the Spalding Collective Care Center is providing telehealth services at 930-3377, 502-930-3377. So shout out to 7 counties and Spalding. They do an amazing job for our city all the time. All right. So, hey, man, there's a lot of heavy stuff going on with this pandemic thing. So we got to recognize that. And again, we'll get through it. We're going to get through it together. And I think we should celebrate some of these joyful stories that we keep hearing about. Today, I wanted to share one with you. There's a gentleman named Scott Zackow in the community with his company Echo ATM. And we heard this earlier today from our friends at U of L Hospital. Scott and his team donated 30 iPads to U of L Hospital because families and friends want to visit the patients in the hospital, but they can't go in because of the virus, right? So Scott wanted to make sure that they could see them, FaceTime with them, see them, and visit with them that way. So what a generous donation by Scott Zackow and his team at Echo ATM, where he just identified a way that he could help, and he helped. He wasn't expected to be recognized like this, but Scott, we busted you. We caught you, and we just want to say thank you for that. Now, I want to also say there's a lot of ways people are connecting each other while still observing social distancing here in our community. A couple of our neighborhood associations, for example, tonight are promoting front porch Fridays as a way for neighbors to enjoy a lovely spring evening together. So pop out on your porch. Very few porches are less than 6 feet away, but if yours is for any reason, stay 6 feet and wave to your neighbor, give him a salute, tip a glass to him, and just say, hey, nice to see you. How things going? Play a little music for him, whatever you can do to get a smile on somebody's face. Remember, it doesn't cost us anything to put a big smile on our face, and it always makes people feel better to see a smile and get a laugh. Now, last week, our Lift Up Lou team toured the city with Teddy Abrams, our great musical creative director at the orchestra, world renowned. He's a great citizen, too. He's got a good smile. Look at that smile. But what Teddy did was he brought safe, socially distant music on the move to people throughout Louisville. Here he is downtown, I believe, at Trayton Oaks. And so he was like in the courtyard of Trayton Oaks. Folks opened their windows, they listened to Teddy, they waved at Teddy, they threw kisses at him, and that's nice. Now, this week, the show goes back on the road with two new performers. Louisville Orchestra's Jack McFadden Talbot and his partner, Heather Thomas. They are both violinists, and they will be performing primarily in Southwest Louisville. And we've added a cool new added light feature as well. So you may see them performing around town live. Of course, we don't announce where they're at because people would gather. So they're just kind of moving around, and as they see people socially distant, or they can pull up to a nursing home or somewhere like that, they're going to do that and play. So you can catch them online tomorrow afternoon, starting at 3 o'clock on at Lift Up Lou on Facebook. Lift Up Lou's gone viral. Had people all over the country ask us on how they can do their own version of Lift Up Lou. So good job to Margaret Brosco and the Lift Up Lou team. And then 7 o'clock every night, Lift Up Lou closes their daily rhythm out with a mindfulness session. So a lot of interest in mindfulness and meditation going on throughout this pandemic. So that's good. That'll help everybody chill out. Maybe we can take it forward with us a little bit too. Just doing some deep breathing for 2 minutes changes your whole way you look at life. As a matter of fact, I'm sure I will be doing that tomorrow online, because tomorrow at 10 o'clock, 10 a.m., we'll have another Facebook teletown hall. The doctor is in. And that's when I'm joined by Dr. John Klein of the University of Louisville School of Medicine, their Vice Dean for Research and a PhD in immunology. We take your questions about COVID-19. He talks about the latest health updates from the week. And then we always close with a little mindfulness, a little meditation. Good way to start the day. All right, folks. Remember, if you have questions about COVID-19, go to kycovid19.ky.gov or call 800-722-5725. We're now going to get to our questions from the media. And let's see, we got a bunch of them on here for you, Dr. Moyer. Your viewers must be missing you since you didn't have a regular session on here. So let's see. Chris Ott asked from DRB. Hello, Chris. Has Metro and/or Health Department had to shut down any businesses in the pandemic? If so, which businesses and why? Dr. Moyer, are you out there?
I am. Can you hear me now?
There you are. We can hear you
All
now.
right. So we have had to close 7 businesses since we started taking calls. All 7 were considered not essential businesses according to the governor's executive order. So all of those were in that. And then we've done 3 citations for social distancing, encouraging those businesses that are essential just to try to practice that social distancing a little bit better. So 3 citations and 7 closures.
So if you're a business and you're not doing the right thing, you could be the next one to close. So please comply. Now, we got another question for you, Dr. Moyer, from Laura Ellis. I'm cooking and baking things to drop off to friends and neighbors. This is a good citizen. Other than sanitizing kitchen tools and pans, plus scrupulous hand washing. Scrupulous hand washing.
Thank you for that.
Is there any reason not to share food I prepared with other people?
So no reason to not share. Just make sure when you're transporting it between your house and their house that you keep it either at the hot temperature or the cold temperature of the food. And then what was the other thing? Just make sure any sauces or soups get reheated to a boil. If your friend that you're sharing the food with, to be extra careful, can put it in their own dish, wash their hands really good, and reheat the food. That would kill the coronavirus, and just make sure there's nothing touching it. So safe to share with family and friends, and love that people are being compassionate and being social without being physically close. I really appreciate that.
No, I mean, whenever I get like any cookies or something like that, I mean, that's like, man, somebody put some time and effort into that. It's like giving love to somebody else. So that's always a beautiful thing. I occasionally get cookies dropped off to me at the front desk at Metro Hall. I like that. It's nice. Okay.
Yeah.
Let's see here. We've got some TARC questions. Laura Douglas, why don't you and I take these? With TARC restricting rides for essential businesses, do you think those essential rides to jobs or the grocery store or to get medicine should be fare free? That's from Darcy Costello, our friend with the Courier Journal. So should we be offering free fare on TARC? I know that there's pros and cons to that. Do you want to talk about those, please?
Yes. Yes, and you're right, Mr. Mayor. There are pros and cons to free fare. In those communities where they are doing free fare, it means that the bus rider enters from the rear of the bus, and that the space on the bus for riders is further limited. We've had some significant feedback from our drivers indicating that they are concerned about rear entry because they want to be able to observe who is entering onto the bus, and they want to make sure that there's order on the bus at all times. It makes it difficult for them. And of course, even with rear entry, there are folks in the community because of their disability who may need to enter the bus through the front door rather than being restricted to the back door. Currently, we have some buses in Louisville that are such that the back door doesn't open automatically. It would mean that the driver has to get up from his seat, go to the back, and literally open the back door for the patron. So fare free is somewhat problematic. It is, as I said earlier, a tool that some bus companies have used, but we have not done this locally yet.
Okay, so still under consideration and lots of national benchmarking.
Yes, we're looking at what other communities are doing. Yes.
Thank you very much. Amina Elahi from Louisville Public Radio. Mayor, you've been encouraging people to do better social distancing in parks, stores, and restaurants. How much longer will you give them to comply before implementing new restrictions, and what would those restrictions be? Amina, I think it depends on what the situation is, because it's easy to close some places down and not others. So let's take, for instance, Big Four Bridge. Big Four Bridge, a very popular place to go. It's only 17 feet wide, so it's harder to be socially distant there. So we're very concerned about the Big Four. So we're monitoring that very closely. We've had good compliance throughout the week. Of course, for people that go there regularly, we kind of ask you to pull back from that because it's just hard to do that. So if we find that that's a problem up there, you can close the bridge. Much easier than, let's say, closing Cherokee Park or Chickasaw Park. So we're evaluating all that type of stuff. We're evaluating closing the roads that go through Iroquois Park or Cherokee Park because as cars go through there, if there's a lot of people on the road, people have to be closer together. So we're working with neighborhood associations, police, council people on things like that. So we're going to take each one of them as it comes, but I would just encourage people, don't put us in a position to have to make that decision. That's what's going to force it, is if people are not complying. Okay, let's see. Chris Otts is asking, will we have to put an open records request in to find out which 7 businesses were closed and the 3 cited? Chris, I'd just ask you to work with Gene Porter on that. Darcy came back with another question. Laura Douglas, is it not possible to have fare-free rides with people entering through the front door?
Well, let's think about the overall implication of fare-free service. In truth, if we did go to fare-free service, it's very likely that the number of bus riders would increase. It would be very difficult to have a controlled setting where we could enforce social distancing. So one of the critical issues involved in fare-free is the health of the passengers and the health of the bus rider himself, and the issue of whether we would have increased ridership and difficulty enforcing social distance on the bus.
Okay, perfect. Thank you. A question's come up about how many police officers and corrections officers have been tested positive. We've had 3 police officers test positive and 1 corrections officer test positive thus far. All the CDC guidelines and our public health guidelines are followed then in terms of people they've come in contact with or they're communicated with, so they know that they need to go into quarantine. I don't, Dr. Moyer, do you have anything to add to that?
Coming off, just getting off mute here, sorry. So, no, I mean, that's correct. So at being Louisville Metro government, I know that corrections and police are working through those contact investigations and notifying people that need to be quarantined and following proper protocols. So
Okay.
That's the new policy, yep.
That was a follow-on question from Darcy Costello, and Darcy also asked, what is Jefferson County's mortality rate for confirmed COVID-19 cases? Do we know that?
Yeah, if you do the math with our 14 deaths and 274 lab confirmed cases, that's about 5%, I believe. But we know here in Jefferson County, just because the national tests are all going to New York and other places that are harder hit, we are only testing people that are sick enough to be in the hospital. And so that's likely not a true mortality rate. That's just on the lab confirmed tests that we have.
Okay. Zach Owens asked from Business First, is Metro considering implementing a citywide curfew? Zach, we'll have to see. We discuss all of our options throughout the week, and then we kind of talk about the conditions that might lead to them as well, and they all have pros and cons, but everything is on the table right now. Let's see, we just got a note in here that the 2 firefighters who tested positive are back to work and healthy, all that, so that's good news to hear that. And let's see, I'm going to say, Mayor, can you address a tip that there have been refrigerated trucks or vans brought to the fairgrounds, presumably to supplement the field hospital there? Sarah, do you know anything about that?
I know that they've been out looking at the fairgrounds all day today, just trying to figure out what needs to be done and how fast it can go up. I don't know anything specific about the trucks or vans.
Yeah, we can get you more info on that, but the first thing is going to go in or be like the beds and stuff that doesn't require refrigeration. Now, it could be part of the plan, but We're working with the Kentucky Guard, the National Guard, on all of that. That's a big operation. The goal is to get that stood up before we need the hospital beds, and then hopefully we're not going to need them. Hopefully we'll have the surge taken care of. Darcy Costello is asking, are you confident that Louisville's public safety employees have a sufficient amount of high-quality PPE? If not, what are you doing to acquire it? Dr. Moyer?
Yeah, so confident, no. There's shortage of PPE all across the country, and here prioritizing PPE for those coming in contact with people with COVID. So that's especially going to our healthcare providers, and then those first responders that are in contact with people with COVID or suspected to have COVID. So our incident management team is working really hard to chase down every lead to purchase more PPE, and we are just requiring a lot of information for when we do give out the PPE that we do have, and just making sure it's being used according to guidelines and that it can last us until we have more sources.
And PPE's been a challenge. I think once we get through all this, we'll be looking back and say, if this was a federally coordinated response versus cities competing against other cities and states versus states, it's a very inefficient process right now. And there's way more demand than there is supply. So you might place an order, then they say, well, we're not going to take your order anymore. You might have had a quote at 95 cents for a mask, and now all of a sudden it's $5.25 for a mask. It is extraordinarily inefficient right now. And we can take a look at that after it's all said and done, but it is not nearly working out nearly as well as it should be, and it's costing the citizens of the Commonwealth and our city and the country way more than what it should be right now. So, but we've got a lot of people working on it. We're seeing incremental progress, I guess we could say, and we're fortunate in this community that we're not like where New York is right now, of potentially running out of PPE in a matter of days. So we still have some time to build ours up, assuming we can get supply. So I want to thank everybody for joining us. I think we've gotten to everybody's questions here, and I just want to really emphasize how crucial it is that everybody does their part here this weekend to stay away from each other, 6 feet away from each other in public places, in our parks, on the bridge, etc., because this is kind of our shot to prove that we can do it as a community once we've heavily communicated on this. And just remember, when you're close together is when the virus passes, and we want to kill the virus. We want to deny the virus, and everybody has a role to play in that. So please comply. Please take care of yourself physically and mentally. Have a good weekend. Join us at 10 o'clock tomorrow morning for our teletown hall with Dr. Klein to talk about the health aspects of this. And then we'll be back on the 4 o'clock media rotation starting back 4 o'clock Sunday afternoon. So take care, everybody. We're doing a good job. Let's keep pushing through this. Take care of yourself. Thank you.